So hey guys, my name is Rishabh Singh, a first year medical student from Eastern Medical College and Hospital, Comella. Welcome to my channel. If you are new here, so please go and subscribe to my YouTube channel. I try to provide you some educational video related to MBBS. I hope you will gain or acquire something new at the end of it. If you like, don't forget to subscribe, like and comment below. Welcome to my YouTube channel. I hope you watched part 1 video of connective tissue. This is the part 2 of the connective tissue. In this I am going to discuss about the specialized connective tissue. So starting with the topic, specialized connective tissue. First classification is supportive or skeletal connective tissue. This is called skeletal or supportive because it supports the human body. So skeletal connective tissue consists of cartilage and bones. In this type, matrix is dense, mineralized due to deposition of minerals, hence matrix is hard. This tissue is called skeletal or supportive connective tissue on the basis of components and matrix. It is of two types, which is cartilage and bones. So coming to cartilage producing cell arranged in periphery, that is chondroblast. These are active cell divide to form mature cartilage forming cells called chondrocytes and also synthesize the matrix of cartilage. So now coming to the covering, the outermost covering of the cartilage is called perichondrium, consists of white fibrous loose connective tissue. The study of cartilage is called chondrology. So now coming to matrix, the matrix of cartilage is called chondrin, which consists of chondrin mucoprotein. Chondrin mucoprotein having chondrin, 6-sulfate and mucopolysaccharide, which is present in form of hyaluronic acid. Now coming to the diagram. So this is the diagram which represent a cartilage. In this you can see chondroblast, matrix, chondrocytes and lacuna. So matrix provide rigidity and elasticity to the cartilage. This matrix provides rigidity and elasticity to the cartilage. Cartilage destroying cells are chondroclast cells. So chondroclast cells are the cartilage destroying cells. Chondrocytes present in vacuoles like space called lacunae. So this lacunae is the vacuole like space in which chondrocytes is present. Now what is chondrocytes? Chondrocytes are the cartilage forming cells, and blood vessels are not or absent in the matrix of cartilage. So the cartilage is avascular. Now coming to types of cartilage. On the basis of forming components of the matrix, it is of following 4 types. Hyaline cartilage, glass-like appearance of matrix and translucent. Most of the embryonic skeleton consists of hyaline cartilage. Fibers are completely absent in the matrix of the cartilage. Exception is few collagen fiber are seen in some. Now location of the hyaline cartilage. The location is nasal septum, larynx, voice box, thyroid, cricoid, arytenoid cartilages, C-shaped rings of trachea and bronchi, costal cartilage which is present between the ribs and the sternum. To articular cartilage, these cartilage present at the end of long bone or the articular surface of long bone. The example of long bone is tibia, humerus, femur. So these all are the long bone. Now coming to its classification, like white fibrocartilage, perichondrium is absent because white fibro connective tissue completely convert into the cartilage. In matrix, white collagen fiber are present as the strongest cartilage. Example is pubic symphysis and intervertebral ribs. Now coming to yellow fibrocartilage. Yellow elastin fiber are abundantly present. That's why they are called yellow fibrocartilage. Example is nose tip, ear pinna, epiglottis. Epiglottis is basically a flap-like structure which prevent the entry of food in the trachea by closing it during gulping and swelling. Larynx or voice box. These are corniculate cartilage. These are formed by the corniculate cartilage. There is a cartilage of Santorini, which are 2 in number, and cuneiform cartilage, that is 2 in number. It is also an example of yellow fibrocartilage. And eustachian tube, which connects larynx, that is throat. Now coming to calcified cartilage or third type of cartilage. Due to the deposition of calcium salts of matrix of cartilage becomes hard like bone. It's called calcified cartilage. It is modified hyaline cartilage and hardest cartilage in the human body. Its location is head of humerus and head of femur. Coming to topic bones. Outer covering of bone with white fibrous connective tissue is periosteum. The study of bone is called osteology. The process of formation of bone and the conversion of cartilage to bone is both called ossification. The hardest tissue is the bone. Bone forming cell is osteoblast, which divide to form mature osteocytes present in the space that is lacuna. Lacuna are the vacuole-like area in which various cells present. Along with the formation of osteocytes, these osteoblasts also synthesize the matrix of the bone. Now coming to components of bone. As you can see, the bone is formed by the inorganic salt 60 to 65%, like calcium phosphate, calcium carbonate, magnesium phosphate. Organic components 30 to 35%, that is ocean protein, collagen fiber, that is protein. Then coming to the, as you can see the diagram, so this is a diagram of bone. You can see Walkman's canal that join with the Hervatian's canal, and there is also presence of nutrient foramen in every bone, because from where blood vessels and lymph vessels enter in the Hervatian canal to provide the nutrition. So as you can see the TS of a bone, in this you can see the lacuna joins by the canaliculi. So this is the canaliculi and Hervatian canal is present, and also you can see the lamella, and also you can see the layer of bone that is periosteum and internal layer that is endosteum. Coming to sharpest fibers. These are the extra bundle of collagen fiber in the outermost layer of the matrix. These are also found in the cementum of teeth, which provide extra mechanical support to bone and teeth. In the matrix of bone, two types of canals are present. Hervatian canal. These are the central longitudinal canal arranged parallelly to the long axis of the bone, in which one or two blood capillaries and nerve fiber are present. Walkman's canal. The Hervatian canal interconnected by the transverse or horizontal and oblique narrow canals called the Walkman's canal to transfer the nutrient from one Hervatian canal to another Hervatian canal. Canal, bone, lamina, lacuna, osteocyte constitute to form Hervatian system, also called osteon. The presence of Hervatian system is a typical feature of mammalian compact bone. So this is a compact bone. It's a compact bone in which you can see the epiphysis, and this part is spongy, all the part is spongy, and you can also see the nutrient foramen. You can also see the bone marrow, which is hemopoietic, that is where the blood cells form, and you can see the compact part. This part is spongy part, this much part and this much part, and this part, middle part, is the compact part which represents shaft. And you can also see the metaphysis here, and here you can see diaphysis, here you can see epiphysis here. So this is a diagram of the compact bone. So now coming to structure of bone, epiphysis. End of long bones called epiphysis, in which a layer of hyaline cartilage is present called epiphyseal plate. In this part, the matrix is present in form of layers called trabeculae, in which red bone marrow is present. So this is epiphysis. Now coming to diaphysis and metaphysis. Diaphysis, it is the middle part of the shaft of the long bone, consists of long bone in which bone marrow is present, which is present with the yellow marrow, consists of white fat. This is the diaphysis. Now coming to metaphysis, small or little part present between epiphysis and diaphysis. After complete bone formation, it is destroyed or degenerated in the region epiphyseal plate is present. It merged on the epiphysis. After degeneration, epiphyseal plate is present, responsible for the elongation of bone because consists of osteoblast cell. So that's why it is responsible for the bone growth. Now coming to spongy bone. Spongy bone. In the spongy bone, Hervatian system is absent. So in spongy part of the compact bone, Hervatian system is absent. In this part, bone marrow cavity is present in form of trabeculae, hence it is also called trabeculae bone. It is also called cancellous bone, consists of osteoprogenitor cells, help in the formation and the growth of new bone from the osteoblast to osteocytes, because it is found in the core of long bone. That's why it is called cancellous bone. Now coming to compact bone. In compact bone, herbation system is present, diaphysis is present. Now coming to type of bones. On the basis of forming component, bones are divided into various types like cartilage bone or endochondral or replacing bone. Example is humerus, femur, vertebra, ribs, girdle bone, except clavicle or the collar bone. Membrane or investing bone or dermal bone, skull bone and clavicle. Sesamoid bone, ossification occur by the help of tendon, dense regular connective tissue. The example is patella or kneecap. It is largest sesamoid bone. Then coming to visceral bone, os cordis, os falciparum, os penis, os falcibera, os rostalis. So these come in the classification of visceral bone. This completes our topic on bone. Now coming to the topic specialized of fluid connective tissue, that is blood. Softest connective tissue of the body, even softer tissue of the body is called blood. Study of blood is called hematology. Formation of blood is called hematopoiesis or hemopoiesis. 5 to 6 liter blood is present in human female, 4 to 5 liter blood is present in human female, and 5 to 6 liter present in human male. 7 to 8% of the whole body weight consists of specialized of fluid connective tissue or vascular connective tissue, that is blood. The components of blood are blood plasma, liquid plasma, fluid plasma or plasma, and the formed element which consists of RBC, WBC, platelet, erythrocytes, leukocytes, thrombocytes. Leukocytes again classified into two types: granulocytes, agranulocytes. Granulocytes are those which contain granules. Agranulocytes are those which does not contain granules in the cytoplasm. So the granulocytes are eosinophils, basophils, neutrophils. Agranulocytes are monocytes, lymphocytes. So this completes our topic on the connective tissue. I hope you like both the parts of connective tissue, and if you like this video, then don't forget to subscribe to my YouTube channel MBBS Studies with Rishabh Singh. Please like, comment, share and subscribe. Thank you.